So shoulder surgery is hard enough, but doing it alone, that brings a whole new level of stress. And most people aren't ready for it. If you're facing recovery without a spouse, kids nearby, or anyone to help you day to day, this video is for you. You're not broken, you're not failing, you just need a plan that actually fits your situation. So before we get into it too far, are you recovering alone or will have limited help? Drop a solo or a partial help in the comments below. I'd love to see how many of us are figuring this out together, alone together. Hey there, I'm Dr. Dan Orcutt, orthopedic surgeon, and I've helped over 1,000 patients recover from shoulder injury and shoulder surgery. So if you're dealing with pain, prepping for surgery, or trying to make sense of the recovery on your own, I'll break it down all for you. So it actually makes sense. Real answers to help you heal smarter, especially when no one's around to help. So let's get into it. If you're preparing now for surgery, also remember to grab the free pre-op checklist down below. I put it together. It'll help you get your space and your routines set before surgery day, especially important if you're doing this by yourself. The link is below this video. So one thing, let's acknowledge this up front. Most shoulder surgery guides assume that you've got someone to help, right? Full-time, but the truth is many of us don't. We're widowed, divorced, independently by choice, or have adult children that live hours away. So if that's you, you're not weird, you're not behind, and you're not doomed, right? You just need a different strategy. Before we go any further, let's get one thing clear. You will not be allowed to go home alone after surgery. Whether it's a hospital or the surgery center, nearly all require that you have a real person physically present to take you home and stay with you for the first 24 hours, at least. That's not a recommendation, that's a medical safety rule. They won't let you go home, they won't let you Uber home, they won't just call somebody from the lobby. You'll need someone there, committed, in person, ready to help. Even if, again, that's just for the first day. So if you haven't arranged that yet, you need to make that your top priority because they will cancel your surgery. That's one part of the shoulder recovery you truly can't do alone, and it's not safe. I want to tell you about someone who worked with me, Jerry. Jerry was a patient. He was early in his 70s, lived alone after his wife passed, and we did a reverse total shoulder replacement on his dominant arm. No kids nearby, no caregiver, just Jim and a few close neighbors, and a lot of anxiety. But Jerry was organized. Before surgery, he rearranged the kitchen so he could reach everything one-handed. He set up his meds in a weekly organizer, and he taped little reminders around places he knew he'd forget, like not to reach, right? So his mirror, his recliner, was it smooth? Not at all. He dropped a frozen dinner one time and had to eat it off the floor. Gross. But he figured it out. He paced himself, he followed instructions, and when he had questions, he asked. When I saw him at 6 weeks, he said something I'll never forget, actually. Doing this alone wasn't easy, but I was never really alone because I had a plan. I had people I could reach out to, and I stuck to that plan. That's key. You don't need perfection, you need preparation and just a little courage every day. So let's walk through the top problems I see and how to solve them alone. Getting dressed, this is a struggle whether you have someone there or not. Make sure you buy some loose zip-ups or button-up tops before surgery. And lay out the outfit, always at waist height, right? Just down below. And a dressing stick, a reacher tool, will make a big difference too. Bathing, install a shower chair, right? Again, this has some to do with being alone, but not. Use pump bottles for your shampoo. Keep a dry towel rolled right next to the shower on a lower level. Also, dry shampoos or sponge baths will work well for the first few days. Meal prep. Make 3, 4, 5, 6, 7, 8 meals in the freezer. Make sure they're in a freezer you can reach. Use the pre-cut veggies or microwave meals for the first week. Move your frequently used dishes down a countertop level before surgery so you don't have to reach up in the cabinet. Sleeping is going to be tough. You can either set up the recliner, the wedge pillow, or something else in advance. Make sure you use the pillow underneath your arm too. Know this, waking up at night is normal. What is not normal is panicking about it and wonder whether there's going to be someone to help you. Because even if you had somebody, they don't really have much help anyway. Meds and ice. So make sure meds, you use a pill organizer, set the alarm, rotate the ice packs. And if you can, it would be best if you have an ice machine. That way you don't have to take the ice on and off with your good arm. If you have a machine, an ice machine, that's going to help make it a little easier. All you have to do is replace the ice in the little container. That's going to be a little easier than trying to get it and keep it staying up there on your shoulder. So if this is helping so far, take a second, hit the like button and subscribe. It tells YouTube to show this to others who are dealing with the same thing. And if you figured out some clever solo recovery hack, post it below in the comments. I'd love to hear it. Doing this alone doesn't just affect your body, it messes with your mind too. You might start wondering, what if I mess something up? What if I drop something and no one's here to help me pick it up? What if I just can't do it? Let me be clear, recovery isn't about perfection. It's about planning ahead, going slower, and giving yourself permission to do things a little differently. It's okay. Let me give you 3 mindset traps I've seen people have over and over in the recovery. Thinking you have to be tough. Tough isn't the goal. Consistency is the goal. It's okay to cry. It's okay to feel frustrated. It's okay to ask for help. That's not weakness. That is wisdom. 2, believing your questions are dumb. So many people suffer in silence because they think they should already know the answer. But how would you? You've never done this. You've never been here before. Ask the question, leave the comment with me, or call your doc. Get clarity. So 3, isolating emotionally. Just because you're physically alone doesn't mean you have to feel alone. Join a Facebook group. We actually have one. You can join it. All you have to do is answer one simple question, whether you're having surgery or not, and we'll get you into the group. Also, text a friend. Connection is part of healing, even if it's digital. Recovery alone is hard, but you're capable, and more importantly, you're not the only one walking in this path. So if you look down below, we have a link to our Facebook group if you want to join it. If you want to get more help, I've got other videos specifically talking about sleep and talking about shower. We'll link those both below as well. And don't forget to grab your free pre-op checklist before you go. You've got this, and I've got your back. Before you go, if this has resonated with you and you are someone who is getting ready for surgery or soon after surgery, I have something interesting coming up. I think really exciting, probably one of the most valuable things I will have ever done in my career. So if you wanted something to help you get through the process, you wanted to help you step by step, making sure what's right, what's wrong, is this normal, what should I do, how should I handle this? If this is something interesting to you, keep your eye out for the next couple of weeks. Thanks.